Good evening and welcome to First Say Chats by Dr. G. I'm Dr. Adana Grandison, your hostess and a physician in Barbados. First Say Chats by Dr. G is a live podcast that provides listeners with a unique opportunity to not only hear complicated medical conditions explained, but also clarify any misunderstandings you may have about that condition. After all, a medically aware and educated patient is an empowered patient. And this evening, our episode is entitled Say No to Self Harm and Yes to Self Help. And our guest is Dr. Elizabeth Rochester. Dr. Rochester is a pediatric and adult psychiatrist currently in private practice. She graduated from the Faculty of Medicine, University of the West Indies campus in 2001. Following her internship at the Queen Elizabeth Hospital in Barbados, her first psychiatric posting was in the Department of Psychiatry, also at the Queen Elizabeth Hospital in 2003. In 2005, she moved to London to pursue higher training in psychiatry at the Guy's King and St Thomas training scheme and later in South London and Maudsley NHS Foundation Trust, including the original Bethlehem Royal Hospital, previously and infamously known also as Bedlam, and considered the oldest psychiatric hospital in the world. She completed her general psychiatry training in 2009, becoming a member of the Royal College of Psychiatrists, and followed with further training in the area of child and adolescent psychiatry, which she completed in 2012. Overall, she has worked in the field of psychiatry for 15 years, and her diverse roles have included clinical work in patient and community, supervision, consultation, teaching, training, and public health education. Her special interests include the use of psychotherapy, talking therapy, just like what we're going to do this evening, in the management of mood conditions such as depression, anxiety, plus emotion dysregulation, stress, and self harm. Good evening, Dr. Rochester.
Good evening, Dr. Grandison, and good evening, everyone. I want to start by thanking you for the invitation to speak this evening. But I want to say that I'm actually speaking as part of a week of activities
Right?
organized by the newly relaunched Barbados Association of Psychiatrists. Um, as a group, we felt it was timely with everything happening in the world just now and the increasing burden on mental health to contribute to the discussion on protecting and maintaining good mental health. We
Absolutely.
were, concerned that worldwide society is quite quick to recognize and empathize with obvious physical impairment and illness, but the same attention is just not always paid to mental health. And when we talk about good or positive mental health, we don't just mean the absence of any form of mental illness, but we mean our emotional, psychological, and social well being, or, to put it a different way, the way we think, act, and feel, and the way how we handle stress, relate to others, make choices, and function within our homes, our communities, and our wider societies.
Now, Dr. Rochester, I wanted to start off, first of all, by allowing our audience to know that this is a very special session. It's in the week of your activities. But also, for this evening, if at any point in time you should feel distressed in any way, there are two numbers, and I'm going to post them in the actual message on the message board that you can reach out to a psychiatrist and you can speak to them if for any reason you feel distress. Again, during this podcast, you can reach out to them. The first number is 436-6450. That's the number for the Queen Elizabeth Hospital, and you can request the psychiatrist on duty, or the Barbados Psychiatric Hospital, which is 536-3091. Dr. Rochester, we always hear lots of conversation about physical health and physical wellness. But tell us generally, what is mental health?
Well, mental health is basically about our emotional, our psychological, and our social well being. So, in effect, the way how we feel, the way how we think, and the way how we act, and the way how all of those things interact together to allow us to handle stress, to allow us to relate to others, to form friendships, to form relationships, the way how those things interact to inform the choices that we make in day to day living, and the way how they interact to allow us to function, whether at work or whether during relaxation times, and how we function not just within our homes but within our wider communities. And in that, we also include our spiritual communities and our wider societies.
Great, great. So tell us, what are some of, or rather, what is the spectrum of of self harm that one could encounter? And we hear, we're now starting to begin to normalize the conversation about self care and taking care of oneself. But what is really the spectrum of self harm, so that we can truly have an appreciation of how important it really is to ensure that we self care?
Okay, well, I think there are two ways of looking at self harm.
Hmm.
There's what I would call more active self harm, and that is individuals who may be somewhat emotionally vulnerable
Right,
and find themselves in overwhelming situations and experiences like what's going on now with the COVID-19 pandemic and with the eruption of the La Sofia volcano, or people who may be emotionally vulnerable for other reasons, like directly related to their environment or their
right,
particular personality traits. And I want to emphasize that when I'm talking about people being emotionally vulnerable, I am not speaking about weakness, because one of the things that I have found in conversations throughout the years is that many people say that people seem to equate their mental health challenges with being weak. So then people become dismissive,
right.
and there is a narrative that you just need to be strong and you can just get over it if you just try hard enough. But you know, if you're an emotionally vulnerable person, it's not going to be as simple as that. And I think it's important that we remember that all of us, we have our strengths, but we also have our imperfections and our flaws. And some people may have the ability or the personality trait where they can see an opportunity in every adversity, but other people are not able to reconcile themselves in the same way. So we
Right.
need to be respectful of that and understand that, you know, at different points in time, we all of us may be overwhelmed by our emotions, by particular situations, and it may place us in an emotionally vulnerable position.
Right.
And when you're in that position, as I said, harm may then develop in different ways. It may be very active or it may be somewhat passive. And passive, I'm thinking very broad. So I'm thinking about how we may inadvertently put ourselves in a position of harm through actually neglecting to look after ourselves. And it's obviously an unintentional neglect. But when you are trying to figure out how am I going to keep up with work, how am I going to look after or contribute to a household, if I've got children, how can I support them while they're doing their online learning, if I've got elderly relatives, how do I look after them? You know, it's very easy to forget yourself in the middle of that. And some
Right.
of the things that you may have been accustomed to doing, like following a good routine, making sure that you make time to have healthy regular meals, trying to incorporate physical exercise, making time for friends, friends, making time for periods to do things that you enjoy and relax. These things quickly go by the wayside. And broadly speaking, we can be introducing ourselves to an element of harm simply, as I said, by this kind of unintentional self neglect, because we just feel too overwhelmed to give ourselves the attention and the care that we need as individuals, often because we're busy supporting other people. But I
Right.
think, an important part of the message that, I would want to share as a mental health professional is how important it is to make the time to look after yourself.
Mm-hmm. Dr. Rochester, I know a lot of persons sometimes feel guilty dedicating some set time to carve out a block for themselves, or ensuring that they do something for themselves. You would often hear a person saying, "Me taking care of myself is selfish, and I don't want to appear selfish," as you just said, because we're so busy sometimes being wrapped up in taking care of the needs of others. Is that really the case? And should we put that guilt on ourselves?
I would say absolutely not. But I
Good.
think I agree with you that it's very difficult to not have that guilt. But it's not wrong to be able to make time for yourself, to look after yourself. Because unless you look after your mental health and your physical health, you won't be in a position to help or support anyone else anyway. So it's kind of like that old cliche, charity begins at home. You're going to have to make the time for yourself. And I know it's difficult. I know it's easy to sit here and talk about it when you've got a busy household, how difficult it is. But, I've said to many people, even if you can just lock yourself in the bathroom for 5 minutes, so you get a breathing space, so you can do some breathing exercises, so you can do some relaxation exercises, just to make a little bit of time for yourself. Or better yet, encourage the other members of your family to get on board as well and say, you know what, we all need a little me time. We all need a little bit of time to be able to focus on ourselves, to make time to do the important things. And when I'm talking about important things, I'm talking about, well, first of all, just meeting basic needs. I wonder how
Right.
many of our listeners can identify with the fact that they get so caught up going through the day trying to get things done in the shortened time frames that we now have to conduct business and various other things. And there's no time maybe to just sit and eat the kind of meal that you would like to eat.
Right.
And then you resort maybe to making unhealthy choices.
Mm-hmm.
And then because your day has been squashed into shorter hours, the idea after all of that, that you're going to turn on the computer and go on YouTube and then find an exercise video to exercise when you're already exhausted, it starts to feel as if there are more burdens in the road and there are more hills to climb than anything else. But I want to say to everybody that if you don't individually make the time for yourself, no one else will be able to do it for you. And
Right.
making the time to look after yourself is one of the few things in these very uncertain times that we have control over. And that's really important because in
Mm-hmm.
situations like we're in now, one of the things that causes the most fear, the most anxiety, the most stress is all of the things that we don't have control over. We don't know
Absolutely.
what the ashfall is going to be like tonight. We don't know what it's going to be like tomorrow. Are we going to be able to go outside? Does it make sense doing a tidy up? Will we be able to get out to work? We have no control over these things, but what we do have some control over is how we organize our daily routine and how we carve out time for ourselves to do the basics, make sure we eat, make sure we sleep, look after ourselves, but make time for the physical activity, make time to pause and breathe,
Mm. And
make
that
time
is
to pause and reflect.
that is actually sometimes the hardest thing to do, because sometimes you can get into a routine of planning. I plan to do this at 8 o'clock. I plan to get up and cook and make sure the children have their food for this time. I'm gonna get out of the house by 7:30. And you're constantly in an act of planning, but never really taking time as you correctly said, to pause and reflect and just be in that moment. I'm really, really happy that you spoke about that. But tell us a bit more, very practically, about some of the things that one can do, certainly, to ensure that they are practicing self care.
Well, I think the first thing is simple thing like using your phone as a tool to facilitate your routine.
Hmm.
I have to say that personally, I am probably a little bit over fond of timers and alarms, but sometimes that's the one thing that helps me to remember to give myself a little bit of time. It's just a cue to remind myself, wait a minute, have I had lunch yet? Have I, taken a stretch or a stroll, even just for 5 minutes up and down the corridor to stretch my legs? So, having not just a plan, but maybe having a routine where you allow yourself to take maybe even 15-minute slots out of the morning session, maybe, anywhere between say 9 and 12, and then another 15 to 30 minutes between 12 and 3, and giving yourself permission to block these periods off wherever you can find them, to just dedicate to doing something that will benefit you. So, I've already mentioned things like making time for a healthy lunch, making time for some form of exercise. And remember, anything is better than nothing. If all you can manage is 5 minutes walking up and down in the corridor, if all you can manage is doing 10 squats, if all you can manage is just walking on the spot for 3 minutes, that's a start and that's a step. Because once we take the first step, then we can continue to build on it. And then we
Absolutely.
can have more and more small successes. And in the process, even if we find there are days where nothing goes to plan because we have other external forces taking control of our day, that's okay. We can just say, okay, that day went how that day went, but tomorrow is an opportunity to reset and to pick up again. I think it's important within that schedule to make some time, as I said, to do some reflection. I think that's really important.
Hmm.
So, being able to reflect on whatever you were able to achieve for the day, even if the only thing you were able to do was roll out of the bed and get something to eat, and then you went back to bed. The fact that you were able to do that and it was a struggle to get out, to make time to do that, that's an accomplishment. If you have a to do
Absolutely.
list and you got 2 things done on your list of 10, that's still an accomplishment. So, making time to reflect on what it is you've actually been able to achieve and what you felt satisfied with doing, and maybe a hope for another day. Some people like to write it in a diary. You can make voice notes on your phone, whatever helps you to just reflect in a kind of neutral or positive way about the day's activities. I think also making time to connect with other people. So that's really
Hmm.
important. So even when you're in a house surrounded by people, sometimes you need to make a connection with somebody on the outside who you
Right.
believe may be experiencing what you're experiencing, because at the end of the day, sharing a burden with someone else is inevitably helpful, simply because they may have some ideas which may be useful to you. You may have some ideas which may be useful to them. So making the time to connect with other people, to share how you're feeling, to share ideas, to hear from them, that's important. And as I said, maybe not necessarily people within your household, just in case you're getting a bit tired of them, but it can be people from the outside if they're available to you to do that. The simple things like managing also your sleep routine. So we have to remember that, mental health and physical health are quite closely linked.
Right.
And, when we settle down to sleep at night, that's a chance for our body to recuperate and to give us, the best possible start on the next day. So simple things like making the time, if you can, giving yourself even 5 or 10 minutes to have a sleep routine. Grab a bite to eat, I have some quiet time, I listen to my favorite music, I have my chamomile tea, I spray my lavender mist, whatever works for you. I sit and play with my children. I talk to one of my parents, whatever works for you so that you can have that calming time. But I think what we can't get away from is this sense that having some kind of routine that allows you to eat as regularly and healthy as you can, fit in at least 5, 10, 15, 30 minutes if you can manage it of exercise in whatever form you can manage it. Dancing while cleaning. If you're typing and you can stand up and move, stand up and move. Singing along to the radio, whatever works for you, but getting those arms and legs moving, getting your heart rate up, doing the physical activity, making time to connect, making time to reflect, and trying to have some kind of routine around sleep. Those, I would say, are some of the basics. And remembering to reach out to others and allowing them to reach out to you. I would say those are the basics. That would be the basic package for self care and self help.
Okay, great. Now, I'm very glad that you stated that it's important to reach out to others outside of the household because a lot of persons sometimes may feel that when they're experiencing something and they may be a bit overwhelmed, that there are very few people, if anyone at all, that they can reach out to. And I know that, for instance, Dr. Emmanuel, when she came on 2 weeks ago, she was speaking about starting where you feel comfortable. So I'm very glad that you actually brought out the importance of just reaching out to anyone. It doesn't have to be necessarily a primary care physician or even a psychiatrist initially, but it might be that friend or a family member or someone on the outside to get the conversation going, who may be then able to suggest, hey, this is probably something outside of my scope. I think you may need to speak to someone. In the Barbadian context, I know that uh, discussing mental health and by extension, then mental illness is something that historically has been quite taboo. But we are starting to normalize having those discussions. Is there any benefit, and I'm sure there is, but for the purposes of our listeners, is there an importance of normalizing that conversation?
Absolutely, absolutely. I think we cannot do enough to address the importance of being able to think freely and speak freely around mental health issues. As a matter of fact, one of the, I guess I would say, guiding principles that the World Health Organization, I think, came out with over 70 years ago was that there can be no physical health without mental health.
Hmm.
So it's almost impossible to have the conversation with the one without considering the impact of the other, and vice versa. And when you consider too that 1 in 4 people may experience mental health challenges over a lifetime. If you think about it, that's a lot of people. That adds up quite quickly. That means any room, any office you go into, a car that you share, there are going to be people around you, or it may be you yourself who are experiencing mental health challenges. So it's far too common and far too important to be ignored. And I think it's helpful to have these kinds of discussions and to give people the opportunity to understand that they shouldn't feel any sense of shame or guilt about talking about their mental health and their mental well-being. We shouldn't have to hide away from the idea that sometimes people need mental health days in order to devote some time to themselves, in order to reflect, to pause, to focus on self-care without having people kind of criticize them and make them feel that they are lesser people or lesser individuals because they've
Right,
chosen to do that.
right. Dr. Rochester, take us through what does self-harm potentially look like, especially in an adolescent population?
Right. So now we're moving to what I would call the more active side of the spectrum of self-harm. So we're now talking about the kind of people you see in clinic who have developed a habit where they may hurt themselves either physically directly or indirectly, usually as a means of coping with either difficult emotions, difficult feelings, painful thoughts, or again, our overwhelming situations and experiences. And I want to just say here, and this is very much true in the teenage population, that self harm or physical self harm may be more commonly seen or recognized because we have the stigmata that people could see, but there are indirect ways of self-harming as well. So we have young people who engage in unsafe sexual activity. They may start to misuse alcohol within the home. They may misuse recreational drugs. They may develop extreme eating habits. So there are lots of actual different pathways you can go down for active self-harm. But the mechanisms aside, what I think is important to try to understand is why it is that our young people or even older adults would want to inflict harm upon themselves. Because when we have an understanding of it, then hopefully it helps us all to be in a better position to support these individuals and get them the care and attention that they need. So for a lot of people who self-harm, often they're trying to either reduce the intensity of the overwhelming emotions that they feel. They just, it's like the overflowing pot on the stove. They need to do something to kind of stop the pot from boiling over all of the time. So engaging in some kind of physical or other self-harm can help with that. Sometimes, and this is often the case, and you've alluded to this already, it has been made difficult for us to have conversations about our mental health or about struggles that we're going through. And sometimes being able to convert the emotional pain into a visible sort of physical injury or pain, it can be a way of communicating as well that something is going on that I need help with, that I can't talk to you about, but there's something that I'm experiencing that's overwhelming me, and I'm demonstrating it to you in a way that I think that you may understand. It can also be used as a distraction. So many people speak about how the physical pain can distract them from what they're experiencing, the turmoil that they are experiencing in their mind. The other thing is having a sense of control. So if you feel like you have no control, especially as a teenager, you have no control over where you go, what you do, the direction your life is going in. I have control over my body. So if I do something to my body, that's me. Nobody can take it away from me. And at least I feel, thank heavens, that there's something that I have control over. So I think that that's a very important one. Sometimes it can be to escape particularly difficult circumstances that may be evolving around them, so it provides a means of escape. And also, because you spoke about guilt, sometimes it can be used as a tool of punishment, because someone may feel guilt or shame that they are not sort of coping in the way that maybe the people around them think that they should be able to cope. Because I think, especially with young people, it's very easy to print your own narrative or your own story on them about how you think they are doing, just
Right.
because it looks like they're more or less doing the right things at the right time. But that isn't the same as actually sitting down with them and asking them, how are they actually doing? What's going on? I seem to be doing well, but is everything actually okay or not? So there are a lot of reasons, a lot of paths that can lead to self-harm. And the reason why they do it too is because for a lot of them, although it's very short-lived, it gives them a sense of relief,
Right.
and it gives them a sense of release. But the challenge is it's often very short lived. So that sets up a potentially destructive cycle where individuals may continue to self harm on a regular basis,
Right.
because we haven't actually dealt with the core reason or the core problem. So,
Mm-hmm.
what we need to do in a first instance when we're supporting these individuals is help them to deal with their impulses in the moment, and then help them to put in place other plans that can help them to manage long term. So, if I can just speak quickly to thinking about things that you can do in the moment,
Absolutely.
what we usually try to do for these individuals is we try to help them to understand what we call their self harm patterns.
Right.
So, what kind of things, what kind of situations seem to trigger this desire to self harm? So, if you remember, when I was talking about general self care, one of the things I talked about was reflecting. And in reflecting, you can maybe keep a diary, and sometimes those diaries can come in useful here in terms of helping someone to think about what they may have been feeling or experiencing on a particular day. Other
Right.
times, if you've got a supportive home environment, you may be able to look to other people in the home or close relatives, friends, sometimes godparents, aunts, uncles might have an idea about certain times when they've noticed that they've responded in certain ways. So, the importance of identifying these kinds of triggers and situations is that once we know what the trigger is, then we can try to mitigate it. So, you can start to then plan a series of distractions, or escapes to help you cope right in that very moment. So, that's the emphasis really in managing more active self harm thoughts. Being able to identify triggers and being able to have a plan or a toolbox. I usually call it a happy toolbox, with distractions. So things that you can go to straight away in the moment without thought that will help to delay the thought or the desire to self harm, so you've got time to calm down and reevaluate the situation. So it may be something as simple as having that one friend or family member that you can call. It may be something as simple as having a go to exercise routine, a go to music list. It may be literally and physically having a happy box, which has in different things that trigger different happy memories.
Right.
If I speak about that for a little bit, basically what we suggest is that you fill a box, literally with different things that stimulate the senses. So all of the senses that help to trigger happy memories. So for example, you might have pictures in there, so you get visual stimulation. You might have a particular scent, a bottle of cream, an aftershave lotion. Just decant it into a smaller bottle, you pop it in there, you open it, it brings particular memories, you stimulate, your sense of smell. We get people to write out music lists, we get people to put things in that they like to snack on, so little packets of whatever it is that will work for them, that will keep over a period of time. And we literally say, when you're feeling this way, go to that. And if
Right.
you can't have a physical box, you can have a virtual one. So a lot of people have phones or tablets that are on them all of the time. Do you have a go-to video that will make you smile? Do you have a go-to music list? Do you like reading? Do you have a particular anime, a K-pop group, whatever works for you? But just having something that can distract you in the moment and give you that chance to gain control over your feelings in a different way other than self-harm. So that's in the short term. But then long term, part of the work would be getting them the appropriate practical therapeutic support,
Right.
so that they can understand the emotions and the feelings that they're experiencing, have them validated, and learn more about how to manage them and how to feel supported in managing them so that they don't act on them straight away.
Great. So you just spoke about both the immediate solutions or assistance that one can provide for themselves is self-help, the immediate solution for self-help, and then the longer term goals that one should participate in, seek in order to ensure really deal with the core of the problem. In medicine, we often say you can either treat the symptoms at the time, or you can also get to understand the core of what is happening so that when you actually make the correction at the level of the core of the problem, you have managed essentially the problem effectively. And I think that that's quite important. Now, Dr. Rochester, we know that, for instance, here in Barbados right now, we're dealing with, I want to say, three three major issues. One is COVID. One is which is a pandemic. Then we're dealing with the infodemic, which sometimes we can feel quite overwhelmed from all of the information that we're getting, sometimes quite negative. And now recently we have been dealing with the La Soufrière volcanic eruption that is placing a lot of ash uh, into our sphere. Um, are there any mechanisms in terms of, for instance, psychological first aid that one can participate in, not necessarily for themselves, but if they want to become of assistance, so they're not experiencing any thoughts of self harm in any form or fashion, but they believe that they can be of assistance to a friend or neighbor, especially during this time. Is there anything that they can do?
Actually, yes. So there's a technique that you can use called a stop, think, go.
Right.
So, stop is about helping an individual to take a pause, take a breath, and consider what the problems or issues are that are the most urgent. Because one of the things that we know that tends to send people into a very negative or a destructive tailspin or cycle is the fact that there's this loss of control. And you
Right.
tend to feel this loss of control when you feel overwhelmed by too many different things all at the same time, and you don't know where to start in order to tackle the issues. So being able to get someone to slow down, stop, take a pause, and help them differentiate what's really urgent and what's really important that I need to address now in order to help myself, in order to help my mental health, my physical health. And what we want to do is to help them identify, I guess, what we would call their circles of control. So this is the circle of things that I can control. This is the circle of things that are outside of my control. So I'm going to actually dismiss all of the things outside of my control as far as possible. I'm going to focus on what's in my center of control, and then I'm going to categorize them. And if you are caught in the crisis yourself, that can be incredibly hard to do. But somebody who is in a position to support you, that would be their job to help you work out what is it that we need to be focusing on now? Do we need to be focusing on work? Do we need to be focusing on school? Are there medical appointments? Do we just need to give you time for yourself? What's at the top of that list? So that's the first thing. So that's the stop, take a pause, figure out what the issue is that we need to address. Think is encouraging the person to think of ways to manage the problem. And that's by inviting them to kind of step outside of themselves and take, maybe as far as possible, if they can, a bit more of a helicopter view of the situation,
Right.
and think about how they can use knowledge or experience or resources that were available to them from the past. And there are specific questions that, and I like your term, the psychological first aider in this case, may want to use. So you might want to ask things like, well, have you been faced with something like this before? What have you done in the past to overcome problems like this?
Mm.
Or what have you already tried doing? Another question, is this something that you feel that you need to manage on your own? Are there friends or family members we can reach out to? Do we need to reach out to your workplace? Do we need to reach out to your church, your religious community? Do we need to call, your physical health, your GP doctor? If you have a therapist, do we need to speak to them? Are there organizations that we need to contact instead? And then kind of finally, do you know other people who may be experiencing the kind of problems that we're trying to work through for you? Do you remember if somebody else was in a similar situation, experiencing the kind of emotions that you're experiencing? Is there someone else that we can reach out to who can sort of buddy up with you and help you through the situation? Okay, so
Right.
that's the think side of it. And then go is basically then trying to help the person choose. So now hopefully we're generating ideas and we're generating potential solutions. We don't know which ones will work and which ones won't, and what's the best one to start with. So then your job as the psychological first aider would be to help them think about what feels like the best solution to start with, and then to kind of be, the cheering squad or the support team if it doesn't go to plan. And you can say, look, it's okay. We didn't know how this was going to work. We've tried it. We'll cross that solution off our list. Let's go to the next thing. Let's work the list. Let's keep working the problem. We are going to get there. So
Right.
stop, think, go. I think those would be the words that I remember. The other thing is, which possibly it would have been better for me to mention first, would be learning to demonstrate what we call active listening. So it's very easy, I think, when you're taking the role of psychological first aider, to sometimes want to rush in and offer all the support that you can, and to kind of like take over and manage things without properly understanding what is going on. And
Right.
what's really important is to kind of develop this technique of what we call active listening. And basically what we mean is just trying to really listen attentively to what the person is saying, what's their point of view, what are they experiencing, letting them talk, not interrupting them because you are sort of concerned about what they're saying or you think it's not true. Just giving them the opportunity to talk, focus on what they're saying, and where it's needed, where it's appropriate, validating what they're saying. So, just offering that reassurance. Look, this is an incredibly difficult and overwhelming situation to be in. All of us are feeling it in different ways. Today, I may be the person here who's supporting you because I'm having a better day or a better week. In 2 months' time, it may be the other way around. So, you're not alone, and just offering that reassurance and validation of their thoughts and their feelings, and then just checking in that you understand what it is they're trying to say, and what they want help with and what you need to support them with. So making sure that you check in and you say, okay, did I get this right? This is what you're feeling. This is what you're experiencing. You're not sure. And just kind of playing it back to them so you can demonstrate that you are taking in what they're saying, but also you want them to understand that you're taking what they're saying seriously and you're trying to understand it. And then, perhaps at the end, if you're able to do it, just being really clear. Okay, this is what you said to me. This is what I think I understand as the issues as you've outlined them. Can we now see how we can work on problem solving and trying to get things back on track again?
I think you just made two very important points, which is sometimes we're so caught up in trying to assist that we sometimes lose our focus in terms of first trying to listen and understand and be able to appreciate that person's point of view, because we may think we have a solution to the problem, and also quite often sometimes that person only needs sometimes for someone to just be listening, to actually hear their thoughts out loud.
Yes,
Sometimes they hearing
exactly.
their thoughts out loud, they're able to then come to a solution on their own because you're just there physically supporting them. And then secondly, also to be able to take the information that they have provided you with. And you made something a very good point, which is to ensure to communicate to that person that you are supporting that it may be you today because today I am in a stronger position, but it can easily and equally be me tomorrow, not even a month or 2 months from now. And so it's quite important to provide that support. Now, Dr. Rochester, as a person who is a caregiver, whether formally or informally, um, what are some of the signs of burnout that we can look for? Because that's really where we sometimes falter in terms of denying ourselves the self-care that we need.
Okay, well, the key things I tend to advise people to look out for would be change in functioning and I guess change in personality slash mood.
Right.
um, so if you are, sharing a household with someone who's usually, quite proactive, they're usually, the first person who's up and about. They've got a plan for the day. They're usually the person to assist other people. Somehow they're, always online at the right time for work or for meetings. And you notice that that's slowly changing and that they seem, just generally disinterested and they're clearly struggling to meet obligations or commitments that they would easily have met in the past. I would suggest that that's probably a sign of burnout.
Hmm.
So that's speaking to adults. With children, I think sometimes they tend to vocalize in some ways. So you might hear, you're otherwise basically mainly lovable lovable child, and it just feels like maybe there's a little bit more irritability from them, a little bit more aggression, and a little bit more reluctance to do the things that they would normally do without problem. So managing getting up and getting in the shower and getting themselves ready for school, or trying to manage some of the, the assignments they may have had to submit in online. So basically, a change from what you noticed before. But I would also say a persistent change, because
Right.
everybody can have an off day when they
Right.
just go, you know what, not feeling it today. I've had many parents say to me during the period of the last online semester that, sometimes they just made a mutual decision with their child. You know what, I'll just send a note to the teacher. Let's just do something fun in the house. Let's bounce balls off the walls. Let's watch a bit of TV. Because I think that we're both feeling a bit tired and stressed out by the process, and that's enough to reset and they go on. But we're talking about these kinds of changes that exist for extended periods of time. So we're talking about days going into weeks, and then the knock-on effect in the functioning in terms of work or school, it becomes more obvious in other things. So things like, I don't really feel like eating that much, I don't really have an appetite, or I go to the other extreme and just eating all of the time because I don't know what to do with myself. My sleep is disturbed. I can't settle to sleep, or I go to sleep changes that aren't part of the previously established routine. I would say, those would be signs of stress and burnout.
Right. Uh, Dr. Rochester, tell tell our audience what are some of the avenues or resources that we have here locally that one can benefit from if they are feeling overwhelmed or distressed at any point in time, apart from what we place in the actual on the message board for acute situations.
Yes, absolutely. Well, I actually would say that those institutions also serve for long term for long
Right.
term problems as well. So If you think that you need more support, so I'm going to, as a psychiatrist, probably start with some of the resources available through psychiatrists, but we are certainly not the only individuals or group of professionals that provide mental health care.
Right.
But certainly using the Queen Elizabeth Hospital, we have a psychiatry department,
Right.
and they play an instrumental role in supporting a wide range of conditions across a wide range of individuals. As well as the psychiatric hospital, where in fact we don't just have psychiatrists, we have multidisciplinary teams. So we have access to psychologists, occupational therapists, and social workers, along with psychiatrists. They all and psychiatric nurses, they all work together to provide comprehensive mental health care. And the way into those institutions is through either the public health polyclinic system. So you can go in and make an appointment with one of the doctors who's based in the polyclinic and explain if you're having particular mental health challenges or concerns, so that they can then forward you to the respective institution if they think that will be helpful. You can also go through a family physician or general practitioner. If you tend to more use private care, they can also refer you on. For younger individuals, we also have our pediatricians. So having a conversation with our pediatrician about any concerns that you may have about a young family member is a good pathway to take. But as I said, there are other mental health professionals. So, for example, I think Barbados Society of Psychologists,
Right.
they have a website, and they have contact numbers. So it's possible to find a list of registered psychologists who are available for support and for mental health care as well. Within our school system, obviously we have guidance counselors placed within secondary schools who are still active even through the online community, but the pathway to approach them is slightly different. So you may actually have to go through a class teacher in order to get to the guidance counselor. But our guidance counselors within, especially the secondary school system, are still active and working with school age children. And we also have some guidance counselors placed within the primary school setting. But also at the Ministry of Education, there is an Office of Student Services, and part of their responsibility is to promote emotional, social, and psychological well-being amongst the student population. So that's another resource that you can tap into. I think, though, the challenge remains people being willing to take that first step
Mm-hmm.
towards getting help. Because often people are, I have to say, scared of going to a psychiatrist. For example, because we are quote unquote mad people's doctors, and it means that you've got a really, really serious problem and you're potentially going to be locked away, and there's a whole set of unhelpful information and narrative that it can exist around seeking help from a psychiatrist,
Right.
when in fact, as many times as we may support people who are on the more severe spectrum of mental health challenge, we also work with helping people who may be now trying to understand their mental health and get a better grasp on how to manage it.
Right.
And similarly, we often don't work alone. We work in conjunction with the guidance counselors, with psychologists, also often with social workers who are often trained in family therapy interventions. So they also have the skills necessary to promote psychological or social interventions as well. So we work with numbers of people within the category of mental health. And certainly, if you come into our office and we think that there are other resources that would be better or more useful for you, then we'll certainly recommend it to you. But I think, for most people, it's going to be taking that step. But, if it feels like coming to a psychiatrist, visiting the psychiatric department in QEH or going to the psychiatric hospital just feels like a step too far, just remember what we said earlier. Start with a friend, start with a family member. Many people find solace within the church, and many churches do offer counseling services. You can start there.
Right.
Then you can, check in, as I said, with a doctor or a pediatrician, and they can also support you. So there are lots of different ways. I think the thing is, if you are willing, or if you recognize, let's say that, if you recognize that you need assistance and you are willing to allow us to help you,
Right.
then we will find the appropriate support that you need.
Right. Right. Dr. Rochester, it has been lovely this evening having you. Are there any final take home points that you want to leave with our listeners?
Yes, I'm actually going to go back to where I started. I mentioned the World Health Organization, and I'm just going to come back to them again because they had this slogan, be kind to your mind.
Yeah. Mm-hmm.
And I think that's an important thing for all of us to remember. Be kind to your mind. Remember to pause, breathe, and reflect. Remember to connect with others. Remember to keep a healthy routine. Be kind to yourselves, be kind to others, be patient with other people's mental health challenges, and reach out to help for help if you need it. Reach out to someone.
Yeah.
It doesn't matter. It doesn't have to be a mental health professional in the first instance. If that kind of support is needed, you'll get there. But just reach out to someone. You do not have to suffer alone.
Thank you. Thank you so much, Dr. Rochester. It was lovely having you this evening. This dialogue, I think, was quite timely, certainly, especially with everything that is going on now. And I wanted to say thank you so much for taking this time out, especially during your week of activities, to come and share this information with our listeners. And I also want to say thank you so much as well to our listeners. And I want to encourage them to follow and join us next week on First Aid Chats by Dr. G, Closing the Gap. Thank you so much, Dr. Rochester.
Thank you very much for having me on this evening.
Thank you.
Thank
Good
you.
evening, everyone.